Ginger?
Anna, I've been researching this very story for close to a year. And what I found is the case studies, the treatment, and the money spent on sexually violent predators is unparalleled to any other class of felons. In fact, Governor Newsom has just approved a $2 billion budget for state hospitals. Those are the people that treat these sex offenders. But the question is, are they actually able to cure these convicts?
The first successful offense actually committed involved that type of process where a woman had gotten out of her car, gone into a store. I got out of my car, walked over to her car, opened up the door, sat down inside, found her registration, found out where she lived, got a map out and found her house.
Christopher Hubbard, nicknamed the pillowcase rapist for his pattern of covering the victim's head during the attack, committed more than 50 rapes in California. He's a repeat offender and the first felon labeled as a sexually violent predator. This interview was conducted by the California Department of Justice, trying to learn why people commit sex crimes.
I'd gone over in my mind how I was going to proceed. We discussed before how I'd gotten the idea from a book I'd read. A story by James A. Michener called The Source, in which there's a rape scene in there where a man hides behind a door, waits for a woman to come back from the well, and he grabs her when she walks through and he rapes her. And I've been thinking about that a lot, that I could use the same technique, the same process, which is what I started doing.
Authorities are trying to use interviews like the one you just saw to try to figure out what makes certain men become sexually violent towards women and children. They're trying to figure out if you figure out the cause, you can mitigate the effect. It's simple physics. But with sexually violent predators, it's not that easy.
They have what we call the mask of sanity, and that is they have the ability to appear like anyone else, except underneath the surface, they have these fantasies and their wishes. So the whole area of threat assessment involves looking at what is the relationship between thought and actions. These are individuals whose thoughts organize and set up actions that they consummate in terms of sexual violence. These are people who this becomes their fantasies. These are people who sexually pleasure themselves with these types of fantasies, and it becomes the center of their life.
A report by the California Coalition of Sexual Offending says in the 1980s, the momentum of the women's movement brought attention to the frequency of sex abuse of women and children. It was at that point the number of sex offenders in California, along with all other states, reached an all-time high. Laws started changing and sentences became longer. In California in the late 70s, rape had a specific sentence of 3 to 5 years. Molesting a child was also punishable by 3, 4, or 5 years. In extreme and rare cases, sex offenders could be involuntarily committed to a state hospital as a sexual psychopath. Treatment at this time was psychoanalytic.
So initially, we started just with psychotherapy, in part because this population wasn't studied as entirely as it has been now. And once we began to determine this, we realized that there are a group of people who engage in sexually violence, predation, and sexual misconduct, and they need a certain level of control.
Under this treatment model, felons were not allowed to earn something called good time in order to get an early release. However, if they were able to convince their treatment team that they had benefited from the therapy, they would be awarded an A rating and determined to be cured. Experts found the reconviction rate between felons who went through this treatment versus those who didn't was virtually the same. By 1995, the California legislature passed the Sexually Violent Predator Act. This acknowledged there was a dangerous number of violent predators in California. Legally, they are defined as a person convicted of a sexually violent offense and diagnosed with a personality disorder, making them unfit for release. This also launched a new approach to treatment. Doctors focused on teaching the sex offender ways to manage their violent behavior. Doctors did a comprehensive study of sex offenders, separating those who went through treatment, those who didn't, and those who were determined to be SVPs.
It's better to say that something like this can be managed if someone has the tools. Potentially it could be medication. It could be an understanding of what are triggers, when is someone more vulnerable to act out, what are the populations that they can't be around, and the circumstances. We've done simple things, like we've had people who flash when they're in a car. Well, we don't allow them to drive a car. That's the only time that they flashed, right? Exhibitionism. So you could work on some of these things if you understand what are the behaviors that take place under the circumstances, how can we change those circumstances, can we change someone's biology sometimes through medication, how can we change someone's understanding, and then what can we do potentially to monitor and assist them.
Now, this test group produced a lower rate than previous programs. However, it still shows a failure rate of up to 20%. The price tag for this treatment done at Coalinga State Hospital is $200 million a year. That works out to a little more than $200,000 per patient. Now, the most recent felon release from the SVP program is Alan James. He's a convicted pedophile and now lives in Jacumba Hot Springs. Coming up tomorrow on the KUSI News at 10, we're going to take a look inside his crimes, his punishment, and the cost involved. Logan.